Question number 2. I would call the grandmother and ask her to come in and talk. I'd listen responsively to her concerns and reassure her that this will be addressed right away, that she has been heard. I'd tell her how much I appreciate her carrying out her granddaughter's health and hygiene needs, caring for her granddaughter's health and hygiene and her needs and her well-being and advocating for her, and that her advocacy is heard and appreciated. I'd schedule a follow-up call with her to report how things were going on the unit from my perspective and ask what her perspective is. I would talk with the unit manager and staff on the milieu to get their perspective and find out why this may be the case, the poor hygiene. I'd talk with the client to find out why she has been neglecting her hygiene and what we could do to support her in bettering that. If this is a sign of depression or other symptoms worsening, I would add to the treatment plan a progress note and a new goal, and perhaps gather the treatment team together to discuss a new set of goals or steps or strategies, interventions to address the hygiene issue. I would bring this up in team meeting and get a broad range of perspectives. If this is a sign of depression or worsening anxiety, or perhaps a symptom of the onset of a schizoaffective type of disorder, I would ask the psychiatrist to evaluate for those or other disorders where medications might be helpful or to adjust current medications. I would set up a goal poster with the client where she can track her hygiene in small steps daily. I would talk to the treatment team on the milieu to support and reinforce her accomplishing the smaller and larger hygiene goals. I'd ask her to journal and call her grandmother every week. Possibly she misses her grandmother's nurturing and care and can have some sessions and recreation time with grandmother. I would follow up with grandmother and progress, whether there's progress or not, and that she is a valued, and let her know that she is a valued member of the treatment team. That's the end of question 2.